Yeah, so I'm Trisha Reynolds, and I work at the Leicester City CCG, but I cover all of the three CCGs, so across Leicester, Leicestershire and Rutland. And my current role is the All-Age Mental Health and Learning Disabilities Senior Projects Officer. But prior to that was the Senior Project Officer on the Future in Mind transformation programme, leading key elements of service redesign, and also working very much in collaboration with partners, stakeholders, children and young people in the very early days of implementing the programme.
At the beginning of that must have been quite a difficult role for you, Trish, in terms of, you know, when we talk partnerships and stakeholders and involving children and young people, how difficult was that at the start of the programme to get everybody on board?
Yeah, it was quite difficult. I mean, in the early days, before I came to the CCG, I was part of the local task group that put together the actual bid to secure the funding and the resources to deliver this Future in Mind programme. So once, we'd established these kind of working task groups to design these, sort of services under a number of work streams and complex work streams around the Future in Mind transformation bid to get the money and the funding. Partners around the table, included children, young people representation, which then actually, we were then able to, from the outset, build in the views and the opinions of children and young people. And unfortunately, they were not part of our kind of task group, but we did have those representatives around the table that could work directly with children and young people and feed in that their views and opinions. So it was quite a challenge because we had really tight deadlines in order to get this, bid in. And once the bid had gone in and, the CCGs found out that they were successful in securing that resource, I continued to go and meet with the CCGs as part of a wider task group to look at, those complex work streams and how we would together be able to kind of shape those and put them in place. On the back of that, then there was an opportunity to go and work for the CCG. So I then, on the actual, implementation of the transformation plan and the programme. So, and I was successful with that. So right from the early stages, I'd been involved in putting together the bid and then, started to work on the programme within the first year. So within that first year, we very much focused on looking at the most poorly children, looking at what their needs were. And the challenge around that was, what do we do about that? Because, we haven't got services currently in place and we have got some resource to be able to do something. So that was in the very early stages of implementing the first services within the Future in Mind programme. And we set up an eating disorder service and a crisis service, which met the needs of the most poorly children in LLR.
Do you feel, Trish, that there's always been a strong appetite for children and young people to work alongside professionals and organisations to support that kind of improvement, change, development in services?
Yeah, definitely. I mean, when we started to look at the eating disorders service and the crisis service, and and I said, unfortunately, we didn't have children, young people around the table. But actually, what we did do is we went out to those services and we asked those children and young people that were part of those services about, you know, what is it that we can do to help in terms of designing these services that would help you more and get better. And we got that information directly from those children and young people by doing it that way. So, you know, and they were really keen to help us. They were really keen to feed in their views about, you know, what was not working well, what was working well, you know. And I think the biggest issue for them was not having the level of staffing, if I remember rightly, Tina, not having the level of staffing to support those services and deliver the most effective interventions. So we looked at that and we worked around that, and that's what we did. We increased the capacity of those services once we'd implemented them to enable us to monitor them, and also to ensure that children are, you know, sort of, that there is a qualitative aspect around delivery of that service, so that the children felt that they actually would go into a service where they'd get the support that they needed.
What do you feel was your biggest achievement?
I think it was, you know, designing services that met the needs of those children across LLR, because, you know, again, it's about, you know, involving children, young people in giving us their views. And, you know, over the last couple of years, we've strengthened our engagement with children and young people around, you know, the design of services. And we developed an early intervention service that delivers, you know, a lot of low to moderate therapeutic interventions for children and young people, and was put forward for a parliamentary award nomination. They didn't get it, but you know, they were put forward for that parliamentary award by John Ashworth, of all people. So really, you know, sort of high level kind of support. Children and young people helped us to design that service, as you know, as well as key stakeholders and professionals, because what we wanted to do was, although we'd got the high level acute services in place and CAMS, you know, was experiencing real high pressures of, you know, referrals, we wanted to support children at a lower level to prevent that escalation to going into high level services. So we looked at what is it that children and young people could access that could actually prevent them from escalating to CAMS. So we designed that early intervention service, and what sat alongside that was Couth online services as well. So really easily accessible. You don't need a referral to online counselling. You know, it's, you know, sign up and access it. There's chat messaging and all sorts of different things on there that children can access. And then as part of that, we decided that actually there was still lots of referrals going directly to CAMS. And so what we wanted to do is ensure that the right referrals were going through to CAMS, and that, you know, because CAMS were telling us, and children and young people in CAMS were telling us, that actually we were referred to CAMS, but we don't really need CAMS. We need something in between. So what we decided to do, so that we could ensure that children and young people got to the right place to meet the needs that they were presenting with, we designed a triage and navigation service, which would triage children and navigate them to the right service to meet their needs. And we implemented that last year during COVID in, you know, May 2020, and has actually reduced the inappropriate referrals by about 50% that go to CAMS. So you're looking at a service by putting something into place where children and young people who have experienced long waiting lists, long waiting times to access CAMHS, that actually in a lot of cases they don't actually need CAMHS, but they need another service. So we're looking at those pressures and reducing those referrals to CAMHS on an annual basis, and looking at ways in which we can prevent children from escalating to those high level services. Over the last year, we've designed with the crisis and home treatment service users a community chill out zone. So the community chill out zone, that's a drop-in centre to prevent children attending A&E to escalate into high level services. The chill out zone has been set up as a 6-month pilot. We're now reviewing that pilot, and we're going to be rolling it out, and we're going to be delivering community pop-up chill zones directly in the community where children can drop in, relax, get away from stressful situations, and stop them from escalating to needing high-level mental health services. So we've done lots of work during COVID that has really been our greatest achievement, I think, over the last couple of years.